Well, as a parent, you usually sometimes get overcome with the milestones that your child is supposed to reach at a certain age. And just to get you a better idea of how this whole thing works, Megan's joining us here. And I guess first of all, how important are these milestones? Sometimes we put too much pressure on them, but they are important, right?
They're very important, especially on our littles. You know, that birth to a year is a big time frame that you're going to see a lot of changes. And so really making sure that they're achieving those milestones, getting those key skills that they need for lifelong learning is very important to build that foundation upon.
And toys are a big part of this, right?
They are. You know, our job obviously is to get up and go to work every day. Our child's job is through play. This is how they learn and interact with the world. And so just kind of brought a variety of toys that we can talk about and look at. So with our littles, that birth to a year time frame, you know, thinking about the age appropriate toys. Is it safe? Is it durable? Is it something that they can really play with? During that time frame, they're going to be doing a lot of that oral exploration, putting toys in their mouth, you know, exploring the world through that. And so finding some of those more safer, appropriate toys, you know, little rattles. I really like these O-ball rattles, cars, because they can get their fingers in them. It really promotes that success. Looking at those skills, can they start to shake it? Eventually, can they pass toys from hand to hand? So looking at some of those key developmental milestones.
And those are the milestones, again, for the birth to
a year.
A year.
Yes,
okay,
that would be the biggest.
To look at
here. So yep, little rattles. They make footballs, you know, little things that they can hold on to. Thinking about some of those as they're developing, what can they begin to, you know, really work with and go from.
And then also, what are some other things that we need to look for? The moving, the rolling, that kind of thing?
Absolutely, very, very important skills. And so obviously tummy time, I can't stress that enough. That is huge. You know, we do that whole back to sleep, but really promoting that tummy time to play is very important, because when you can put your child on their tummy, they start to get that extension pattern, they're getting the weight bearing, they start to get those eye-hand coordination skills, all very necessary things to be successful in school and that academic success several years down the road.
And as far as toy-wise, when it comes to that kind of thing, it's very simple, really. It doesn't have to be anything elaborate.
No, you don't. Honestly, you know, some of us have, you know, real limited budgets. You don't have to have any equipment for this. Put them on your floor. Throw down a rug and play. Get some of your little toys and engage with them. Lay on their floor with them. You know, mirror that tummy time, what it looks like. Getting those extension patterns into place. You know, do some of those basic cause and effect things. Look, mommy has the rattle. Can you watch it? Can you get it? Can they start to reach for it? You know, real basic components that you can work on.
And then eventually some of the milestones too, like you mentioned, shaking, smiling.
Yes, making sure that there's that give and take. Are they cooing back at you, starting to make those noises, those babbles? You know, like you said, shaking the toy, getting that bigger arc. Can they pass it from one hand to another and back? Can they start to, as they are growing, work on like Cheerios, some of those little finger foods, starting to get that pincer grasp. That is very important. We really have to build that precision side of our hand.
And if we have concerns, questions, not sure if they're reaching the milestones, what do we need to do?
Absolutely. The Children's Rehab Center in Hastings, and we have one in Grand Island, we do offer free developmental screens. So you can always give us a call. We can take a quick, it's about 15-20 minutes, so we can take a peek at your child, see what your concerns are, kind of give you an arsenal of things that you can run with, and, you know, go from there. If there's some greater concerns, we can definitely visit with your doctor and work on getting a script and see them for some therapy.
Well, right now that's kind of talking about birth to 1 year. We have more milestones we'll talk about later on in another segment here. Thank you so much, Megan.
Thank you.
And if you have questions, go to our website, nebraska.tv. You can watch this interview right there.